Welcome to the Patient Advocacy Show. I am Jaspreet Dhanoya, along with our Patient Advocacy Club members and research team at Touro University California. Disclosure: the views shown in this presentation may not necessarily represent the views of Touro University. In this episode, we will discuss our Touro University California documentation guideline with attention to our second guideline, which reads, patients should answer all history questions in preparation for every medical encounter. The purpose of this community outreach video is to improve patient-provider communication in the clinical setting. In particular, we want information in health records to be accurate so patients are heard and understood, and also meaningful so medical providers can discover an accurate diagnosis and effective treatment plan for each person. In the description of this YouTube video, we include an IRB approved survey. I invite you to watch this video and then click on the link. We would like to know how you feel about these new policy changes with your answers and comments in the survey. Our second guideline reads, patients should answer all history questions in preparation for every medical encounter. Why is this important?
There is a big policy change starting January 1st, 2021. Documentation of the history, also known as the medical interview, into the health record in the outpatient office setting, is no longer part of the payment formula for doctors and medical providers. Patients are now encouraged to personally answer the medical interview questions. They can do this in advance of the visit, so the time spent with the provider can be used to better figure out what is wrong and what can be done.
Thank you. It is a big policy change. But wait a second. Does this mean the history, as you say, also known as the medical interview, is eliminated?
No, the history is not eliminated. True, the volume of the documented history is no longer part of the physician payment formula for office visits. Prior to 2021, medical providers needed to document certain amounts of history information in order to get paid. Now, no amount of history documentation is mandated. It is up to the medical provider to decide how much is medically appropriate. New policies reach out to patients themselves to answer the standardized history questions and submit them so the provider starts a medical encounter with the patient's story already documented in the health record. The patient's history is not going away. It is actually finding better ways to involve patients.
Thank you. New policies are finding better ways to involve patients and health providers. Why did these new 2021 policy changes occur?
These changes are a consequence of a CMS Patients Over Paperwork initiative, which, led by CMS Administrator Seema Verma, is a response to an executive order to, quote, cut the red tape and reduce regulatory burden in 2017. A series of policy changes have been occurring over the past 2 years. The biggest change, however, just occurred January 1st, 2021. As of this date, the way the history is documented and counted toward physician pay changed dramatically compared to rules since 1995.
All right, thank you. What was the problem with the old way of documenting the history?
The old way forced doctors to spend more time focused on entering information into a computer than focusing on the patient. For 1995 and 1997 documentation guidelines, the history encompassed about 30 questions. Built upon the chief complaint, the history of present illness, status of chronic conditions and diseases, review of systems, past family social history, these all created a comprehensive list of medical interview questions. There was nothing wrong with the questions, but it became obvious that it takes a medical provider too much time to ask these questions and enter each of the patient's answers during a typical medical visit. New rules seek greater efficiency because it encourages patients to play an active role in telling their own medical story.
Great. How can a patient complete a history in preparation for an upcoming office visit with a medical provider?
Many medical practices routinely give patients history forms to complete in the waiting room. In light of COVID-19, we are not promoting extra time in the waiting room, but you may be able to access a history form either from your medical provider or through your health system's patient portal. If none of those are available, our club has forms that you can use for free. It's a 3-page form that you can download and print out, or use a digital version that you can complete and either print out or email to your provider.
Thank you. So new rules encourage patients to answer standard medical interview questions in preparation for a medical encounter. Are these questions difficult for a patient to answer?
No, they should be easy to answer because the questions are all about you. Imagine being a patient with a medical problem. Severity, for example, asks, how bad is your problems, say, on a scale from 0 to 10? Who knows the answer to this question better than the patient? Quality, another history of present illness question, asks, what does your problem look like or feel like? Again, who knows what a problem feels like better than the person experiencing the problem? These questions are easy to answer, particularly if you have the chance to think about each one and formulate an appropriate answer. What is difficult is trying to answer these questions in an examination room, especially if a health professional is asking them quickly.
Good, thank you. Patients are now encouraged to answer history questions, and our team promotes use of standardized set of history questions. Why should patients fill out a form based on 1995-1997 documentation guidelines? Why not simply write out what their problems are, however they like?
The history medical interview, as structured and defined by 1995-1997 documentation guidelines, is the journalist's equivalent of who, what, where, when, why, and how. If you give a medical provider your history in the format of long-standing guidelines, they will be able to readily recognize the structure because that is how they were trained, and it is what the profession has been using for decades. It will also create a format consistent with the electronic health records.
Great, thank you. So the standard history questions are thorough. Does the history format give patients the ability to tell their story?
Yes, answering all of the history questions, which are about 30 questions, tells a detailed story. Some questions are very specific, such as location. Where on your body is the problem? Other questions, such as status of chronic conditions or disease, are designed to capture the patient's experience with a disease or condition. Status allows the person to describe, for example, how they are doing with diabetes. The person may describe home sugar readings, toleration to medications, and how they are doing with diet and exercise.
Perfect. New policies are cultivating the patient's story, authored by the patient, to be documented in the health record for office visits with a medical provider. Why is it important for a person's story to be documented in the health record, particularly in the history section?
The purpose of health record documentation, according to the Annals of Internal Medicine, is to retell the story. When your story is properly captured in the health record, then all health professionals will have the best chance to deliver the medical care you need. For the medical provider, it means being able to hear and understand your needs and concerns. As a patient seeks subsequent medical visits for a problem, the story evolves. A medical problem may begin with very nonspecific symptoms, but over time may develop into an obvious diagnosis. Health record documentation tells the story.
Thank you. Documenting the history retells a story in the health record. How long does it take a person to complete their own history? Or, as we in our research team say, a prehistory?
The first time may take over 30 minutes, and if done far in advance of an upcoming visit, it is likely that you will revisit your prehistory several times with additional information. Total time to get it right when completing your first prehistory could be about an hour. Creating a subsequent prehistory should take about 15 minutes because you don't need to rethink about your information from your last prehistory, such as surgeries in the past or other information that hasn't changed. Think about how we have traditionally gathered the patient's story. We've been expecting the doctor to ask basic questions and write down answers within a few minutes during a typical office visit. That's not enough time to capture the whole story. As our TUC documentation guideline references, the old way pressures medical providers to use auto-population computer features. The computer will enter a generic story, but it won't be as accurate as your own story. Many times, patients see a medical provider and then think of all the things they meant to say on the way home after a visit. By completing a history in advance of a visit, what we call a prehistory, and by taking the necessary time, you can best express your medical needs, concerns, and experiences with chronic conditions, and get it documented in the health record.
Nice, thank you. What if someone has difficulty completing a prehistory and answering all the questions?
We encourage individuals to enlist help from a family member, friend, or caregiver. Some people may have trouble reading the questions because they have poor sight. Some people may have difficulty answering the questions in English. This can be overcome with help from people close to you. At Touro, we have been exploring better ways to help people who need more help. We are working on creating YouTube community outreach messages that review the prehistory in various languages, from Spanish to Punjabi.
Okay, so if a person completes a prehistory, how does she submit it to her medical provider?
One way is to attach it electronically in your health system's patient portal. You can also send it as a message to your provider in the patient portal. If you do not have this option, then you can print it out and hand it in when you attend your medical visit.
Thank you. Have the advantages of completing a prehistory been studied, and have they shown benefits for the patient?
Yes, a clinical research study published in 2017 investigated a family practice office where patients were encouraged to complete a prehistory in preparation for a visit with the family doctor, with understanding that what the patient wrote would author the history component of the visit in the patient's health record in accordance with federal law. Patients submitted the prehistory at the check-in window before seeing the family doctor and received a printed copy of the entire encounter note, including the history, examination, and medical decision-making at the checkout window at the end of the visit. Patients were instructed to go home, read their health records, and complete an anonymous survey. Per the survey's results, patients reported feeling better heard and understood because they completed a prehistory. They also felt more empowered in their healthcare. They also scored their satisfaction at 97%. This study showed what it is like to start the visit with important information rather than struggle during the visit to gather basic facts. What is interesting with this study is patients were given a printed copy of the entire encounter note at the end of the visit, not just some discharge instructions or a list of diagnoses, but the actual note which showcased their history, which captured their medical needs, concerns, and experiences.
Yes, thank you. It makes sense that patients felt better heard and understood, since they were the ones to create the narrative. What are the advantages for medical providers if a patient elects to complete a prehistory?
It takes a long time to reflect on each of the history questions, formulate an answer, and then type or write the patient's answers to each question into the health record. Reading a completed prehistory, which takes less than a minute, gives the medical provider an opportunity to understand the whole story. From there, the provider can ask additional questions, perform a pertinent examination, and then address medical decision-making. A Gallup survey showed doctors typically spend an average of about 11 minutes after hours per health record, sometimes later in the day or over the weekend, to finish documentation. This new process of encouraging the patient to author the history can result in completing all documentation by the end of the medical visit. This means doctors can more effectively handle paperwork while better understanding the patient's needs. Of interest, because both the patient and provider are highly engaged, medical decision-making can readily evolve to shared decision-making. This is where patients and providers work together as a team to agree on a diagnosis and treatment plan.
Great, thank you. We've addressed why and how individuals should answer history questions in preparation for every medical encounter. But why should they answer all of the questions? Why not just 5 or 10 questions?
Answering all of the history or prehistory questions tells the whole story. It may seem easy for a simple problem to only answer some of the questions, but it's best to tell the whole story. Heartburn, for example, may simply require dietary changes, such as not eating before going to bed. Heartburn, chest pain, and shortness of breath with exertion, however, may be a cardiac problem and need medical attention beyond not eating before bedtime. Answering all of the questions delivers the whole story. As we mentioned, you can use our research forms, and we expect that all health systems will soon have something like a prehistory as a feature in all patient portals. The bottom line for patients is tell your whole story and answer all of the questions.
I would like to thank all of you for viewing this episode of the Patient Advocacy Show. I hope this episode helped you better understand new health record documentation policies and how they impact patients and medical providers. This community outreach message also includes an IRB-approved survey, which can be found in the description area of the YouTube video. I encourage you to participate in the survey. Our team will track responses and report results back to you in future episodes. Thank you for viewing, and we'll see you in the next Patient Advocacy Show.